And it begs the question, maybe being on this metabolically healthy lifestyle may even slow down or delay the advent of these diseases, whether it's Alzheimer's disease or diabetes or obesity or cancer or cardiovascular disease. Because as we all know, type 2 diabetes doesn't start when I'm in my doctor's office and she looks at me and says, "You're a diabetic."
That's right.
Instead, it's years to decades earlier. And cancer probably has its roots earlier as well as does those other diseases. So if we wait until the doctor diagnoses them, we're at a disadvantage. So the idea is prevention with lifestyle. If we can't cure cancer, let's prevent it.
Welcome to the Protecting Your Nest podcast. Let food be thy medicine and let medicine be thy food is a famous quote often attributed to Hippocrates. Now, this quote emphasizes the fundamental importance of nutrition in promoting and maintaining our health. It embodies the idea that the food we consume plays a pivotal role, not only in nourishing our bodies, but also in preventing and treating many of the diseases that we worry about. So if nutrition is so fundamental to the health of humans, it would be logical to make sure future doctors are given a proper education on nutrition. Some of this education can occur while they're in college, in medical school, and potentially even in their residencies. But for most doctors, not only did they not get a firm footing on nutrition, but are taught many principles that simply lack the foundation they'll need to heal people. In fact, in some cases, they've been lied to. So today, I want to talk to the author of Lies I Taught in Medical School to provide his perspective on the things that we could have been taught better for all of those clinical folk out there. Today's guest is Dr. Robert Lufkin. Dr. Lufkin is a metabolic doc like myself and longevity expert. He's actually the host of a podcast called Health Longevity Secrets Podcast. So I really encourage you to check that out. He's also a practicing physician like myself and has served as professor of UCLA and USC medical schools. And he's authored many peer-reviewed scientific papers and 13 books or so. I really wanted to bring him to this conversation because we are so desperate to make sure the people who provide care are not lied to. And I think if we have a sense of what the lies of the past have been, maybe we can prevent those lies in the future. So with that, my brother and friend, I welcome you to the podcast today.
Oh, thanks so much, Tony. You're my brother. I have to say that I'm a huge fan of your podcast. I listen to it all the time and the work you do. So it's a big treat and an honor for me to actually do this today. I'm so excited.
Yeah, I was just as excited. I was sharing with my wife. A lot of times she's asking me, "Are you excited?" I said, "Well, today I'm definitely excited." And I do agree that we have very similar perspectives. And I just think it's so important. Sometimes I have guests who are patients. Sometimes I have, experts. But I think it's important that the clinicians have perspective. And I just think the work we're doing to spread a different perspective is very important. Hopefully our young doctors and advanced practice clinicians are kind of getting this message. And we just got to keep saying it over and over again until it becomes the standard, until we have a metabolic specialty, which is kind of one of the things I'm hoping for. So speaking of specialty, you are in the radiologic field, and I'm always intrigued by that field because I just have this, this image of a guy sitting or a gal sitting in a room, a dark room, reading things, and it seems so different from the world I exist in. So I'm just curious, just speak a little bit about why you chose to be a radiologist and how you integrate this teaching of metabolic health into your practice.
Yeah, great question. Well, I started out in family medicine and internal medicine. I love that area, but I was drawn, my love of technology and computers and MRI was just, magnetic resonance imaging was just happening as I was doing my training. So I sort of got drawn into that, and I loved radiology, but I think it helped me with metabolic health because modern medicine, especially at medical schools, is very siloed.
Yeah.
There's a endocrine specialist, a neurosurgeon, a neurologist, and each person knows their specialty and they see their diseases through the lens of that specialty. And radiology is siloed also, but it's interesting that as a radiologist, I get to look at someone's coronary angiograms and I can actually see the calcification in their coronary arteries. And I can look at their brain and see the decreased glucose metabolism in the Alzheimer's patient. And then I can look at all the findings of diabetes. So I think it sort of helped me take a more holistic approach to metabolic health, like you've done, and it's informed the way I look at it today.
Yeah, I think it's so cool in a way how we all have a different lens. Your world is different than mine. If I talk to a cardiologist, I'll get a slightly different perspective. If I talk to a pathologist, I remember when I was, I think I was at Mount Sinai Hospital in the Chicagoland area, and I'm hanging out with a pathologist, and I'm just so fascinated with the world they live in, looking at slides and seeing disease through that lens. And the beautiful thing is this big orchestra of people who all kind of work together to help patients and to just find out what's going on with folks. And it's just a gift. So I really, it's just interesting to hear your perspective, because I would have never thought that, radiology was looked upon the way you see it. So it's kind of cool. So thanks for sharing that. And I know you got into metabolic health, obviously, because there was some struggles. So just speak briefly for my audience about the medical struggles that helped you shift your thinking.
Sure. Yeah, I basically was following my career as a medical school professor in radiology for many, many years. Everything was going fine, and then, like so many of people in this space and our colleagues, they're faced with a personal event, and I came down with 4 chronic diseases that. I went to my doctors and I said, what's up? And they said, oh, don't worry, we'll give you these prescription drugs, and
That's right.
you need to be on these drugs for the rest of your life, and they will, to control these diseases. And I thought this isn't going to end well. I had 2 young children at the time, and I began to reach out and then ask questions and dive a little deeper. And whoa, it blew my mind what I realized that I completely wasn't aware of, and maybe even would never have been aware of if I hadn't been forced myself out of self-interest and self-preservation to do this.
That's awesome. Yeah, I think, first of all, shout out to all the doctors who are hearing this message for the first time. Yes, it's possible that patients don't have to be on medicines for the rest of their lives. And would life be different if we didn't have to be on medicines for the rest of our lives? Would the interaction with the patient be different? Would the hope be restored? And I think that's the gift of learning about metabolic health and the root cause, which I learned in my functional medicine training. There is a way to heal from nearly, like most of them. There's some tough ones like COPD. I had a patient today who suffers from that, and it tends to be progressive. You just slow it down when you achieve metabolic health. But I'm going to tell you, man, there are people getting off medicine left and right, feeling better, healing. So I'm just happy that you shifted your thinking. And one of the things that we had to both do, and I remember what motivated me to do a confession video was you. I saw you do your confession video, Sorry to My Patients. So I think Dr. Kim Berry did one, and others.
Yes.
And I certainly did my confession videos. I apologize to my patients for maybe misguiding them. So, but your book feels a little bit like a confession as well. So talk a little bit about why you wrote that book.
Yeah, I've got a lot to confess. But before I answer that, I just want to emphasize one thing, that I'm not anti-medicines. I'm not anti-Western medicine. If anything, I'm part of the establishment. I teach at medical schools. I'm not a conspiracy theorist, but I wanted, and I think Western medicine for certain diseases, like if I break my arm, meditation will help, but it's not going to deliver on that. If I'm in an automobile accident and I need a blood transfusion,
Yeah.
Changing my lifestyle at that point isn't going to be a solution. So I'm not advocating anyone stop their medications without talking to their doctor. And this is
Right.
a process. But what I discovered was that certain chronic diseases and very important chronic diseases, if you look at what I will die of, what you will die of, and most of the people listening to this podcast will die of, it's a short list of 5 or 6 diseases.
That's
And these
right.
diseases determine our longevity. And
That's right.
that longevity is a whole nother conversation. But these diseases are chronic diseases that don't really respond at a root cause level to medications. There's surgery and there's pills, but what I realized with the diseases I had and these other chronic diseases, that the pills I was given, or if it's like a stent in a heart attack patient, don't do anything to control the underlying disease, and the
Right.
disease continues to progress. So whether it's insulin for diabetes or hypertension medicines or, Alzheimer's, there aren't really medicines. But I guess the real wake-up call, the realization to me was that the diseases I had and these chronic diseases that are represented that all of us will face are linked by common root causes, and they're basically the same things.
I
That
know.
they're inflammation, insulin resistance in a large part. There are some exceptions and outliers,
That's
but
right.
at a basic level, those two things drive our aging and our chronic diseases. And the fascinating thing is there's not really a pill for
No.
those. And yet, on the bright side, they're immensely responsive to lifestyle changes, specifically nutrition, but also sleep, diet, and other things you've talked about a lot
That's
in your
right.
program. And this is a wake-up call to me, and it's empowering to the patients, because suddenly it's not about getting a pill from the doctor, but it's about taking control, having agency in my own life. And the great thing about lifestyle is I get to start over every single morning. When I get up, I make decisions about when I eat, what I exercise, how I relate to stressful events in my lives, all these things. So it was really a wake up call, but it was so empowering to me as a person and to all of us as individuals, that we take control of our health.
Yeah, I love all of that. And I just really love the fact that what you're saying is, I'm not an anti medicine doc. And I'm just like you. Literally, this whole interview is like interviewing myself, because most of what you're going to say is like what I would say. But I totally agree. I'm in a large health system, Advocate Health. I am conventional as they get. I integrate this metabolic stuff into my practice. But just like you said, not anti-medicine. I use that as bridge therapy, but the root cause of disease is critical to healing. And what's really cool and empowering, as you've suggested, is now the patient doesn't have to depend on this $500,000 medicine per month. They can actually are empowered to do something so that one day they don't have to take that medicine. So it's just a completely different shift. And I just want to empower people. If you're checking this out and you thought it was impossible to get off meds, for the most part, that's probably not true. Another thing about us that we have in common is that we both, went from a plant-based diet to more of an animal-based diet. My question to you is, I have patients who thrive as vegans. They have to take supplements, but what was it about you, taking on this plant-based diet that didn't work for you?
Yeah, great question. I was a vegetarian for almost 10 years, a vegan for probably 5 years after that. And I did it partially out of, I believed it was healthy. I thought it was healthy of doing it for my kids. I was thinking spiritually for the planet, all
Mhm.
sorts of reasons. But first and foremost, I thought I was being healthy. And I don't think vegan diets are unhealthy. I first of all, let me say I love all my vegan friends. I love my
Yeah.
carnivore friends.
Yeah.
I don't feel the diet itself per se is unhealthy. You can be an unhealthy carnivore. You can be an unhealthy vegan. But I think it's more challenging, as you say, to be healthy on a vegan diet because of the
Yeah.
supplements you need to keep an eye on. But
Yeah.
my path is just getting rid of junk foods. There are a lot more vegan junk foods and vegetarian junk foods than there are animal junk foods, but there are animal-based junk foods as well.
That's right.
So my path is to get rid of the junk foods, and wherever that is on the spectrum, plant or animal, I'll go there. And I try to be open-minded about it and look at the evidence, and if tomorrow there's a controlled, reputable study that says that drinking Coca-Cola will make me healthy, I will order it by the case. And
That's
I
right.
love Coca-Cola, but I don't drink it anymore because I
Yeah.
know what it does.
Man, please. I can't wait to see that study. Considering the Oreo cookie thing that came out,
Yes.
you never know, right? Anything that's possible. So, there's many ways to heal. Obviously, we're kind of talking about nutrition. Um, and my functional medicine, my nest and rope really focus on other aspects of healing. So, anything else that you really feel are important for people to focus on as they think about healing in general?
Well, for me, I think the most powerful thing was nutrition, because it's something we do every single day. We take that medicine of food unless we're fasting. And the second thing, equally important, but it's harder to get a handle on it for me, was mindset and the power
Hmm.
of the way we see the world. Stress is a big driver of all these diseases and inflammation, insulin resistance. And stress is interesting. Unlike nutrition, stress is how we interpret the world that comes to
Hmm.
us. In other words, a given event for one person can be very painful and stressful and make them unhealthy. A very similar event, and that could be like an operation, a surgery, it can be very
Hmm.
stressful for people. But that same event with the same amount of pain could be a joyous event to another person if it's childbirth, let's say,
Hmm.
or something else. So it's how we frame what happens to us in the world. And I think that doesn't get as much attention as it should. And I'm constantly trying to remember that and learn myself.
Yeah, that's absolutely true. And I delivered a lot of babies before I got into more of an adult population, and with every delivery, I'm like, so the baby's gonna come out of there, really? Is that gonna really happen? So shout out to all the moms. I actually saw a
Yeah.
patient today who had their newborn baby, and they bring so much joy in our lives. So now another thing that is important, particularly for a guy who teaches students, is making sure the information gets to our doctors. And, I know that, doing research for you, you had some exposure to Gary Taubes, Good Calories, Bad Calories, great author, great guy. Um, and you were kind of fortunate to have that exposure. So many doctors won't be exposed to Nina Teicholz, Gary Taubes, docs like ourselves and others. So does that keep you up at night?
Yeah, it does, because the way people are trained today, the systems, the institutions that are in effect are sending a different message than what I believe is to be the true message that's defendable
Mhm.
by studies. There are, as we all know, there are pernicious financial incentives that drive our medical education and even what doctors see in the articles that are published, and this sort of thing. So it's very concerning when when our leading scientific societies, like the American Diabetic Association, famously posts a lot of sugar laden
Mhm.
recipes on their website, indicating, well, you just cover it with insulin, don't worry about it. If
Right.
you peel back the rug a little bit, you see one of their biggest contributors is DaVita Corporation, which
Mm.
is involved with dialysis. And
Yep.
of course, the number one cause of renal failure in dialysis is people who eat sugar and develop type 2 diabetes. So the American Diabetic Association, American Heart Association, it goes on and on. The American Dietetic Association as well was founded by a group with a strong religious agenda. No, nothing against religion, but it was an agenda that was heavily against. It was a heavily vegetarian vegan agenda, and it's discouraging people from other choices that might work for them. And it's, there are all sorts of things going on with this, and it's a great point you've made. It's a challenge that we've got a lot of work to do on.
Yeah, and it's I don't know if in your field, like radiology, like we have the option, instead of having the boards every 10 years, we can do the longitudinal programs where we get, we do, questions every few months to kind of stay current as board certified. And so as I'm learning and listening as a continuous learning, which I actually think that's better, I noticed that they may mention nutrition briefly and say, here's what you do to treat this. But rarely do they go into the weeds and explain what that looks like and what to do. I also noticed that when it comes to how we're judged, I will be penalized if you're not on a statin or maybe on Jardius medicines like a cholesterol medicine or medicine that's supposed to be for your diabetes or your heart. But I don't get dinged if I don't say I'm doing the right diet. So it's almost like, so the incentive for clinicians, young doctors and old, to focus on nutrition is just not there, which is why I think it's going to be so important that how we fund things is going to be important. And it's also how we teach things. We can't just tell people to eat better and expect that, we have to literally show them how to eat better. So I think about the next generation, and you are a metabolically trained doctor and you integrate that into your teaching, but do you see that happening beyond doctors like yourself? Because you're in an institution where you can see, do they get any of this metabolic teaching elsewhere?
Very, very little. And, there are still things being taught that at my institution and other institutions today by otherwise very well, they are intelligent doctors. I just happen to disagree with them, but things that are it's the wrong metabolic message. So I think, and it even has to enter our culture, kind of our zeitgeist, to like people still think that drinking a glass of orange juice is a healthy choice, which,
Right.
For glucose metabolism, it's really not. And people, the average person will say you're more likely to get a heart attack from eating a red meat than you are from eating a candy bar, which
Right.
I believe it's just the opposite is
Right.
true. So
Yeah.
there's a lot of change that has to be made in our behavior and all.
Yeah. And it's a lot, and it's very nuanced, because even if you can educate a person that the red meat's not going to stay in your colon, the red meat is not hard to digest, and if they come up with a digest, they may, well, maybe you just haven't made enough acid, and you just haven't given your body a chance to digest it. But so I think there's so much nuance, and people never get to nuance because they look at the big messaging out there, and the messaging is that red meat's bad, saturated fat is bad, things like that. So we're constantly having to fight that. One of the reasons why we have a lot in common, you just didn't know it. Longevity is absolutely something I'm a fan of. We all should be a fan of that, but I'm really interested in learning more about longevity. But there are some there's a lot of noise in the longevity space. I think about a leading scientist like David Sinclair, who's arguably the most well-known longevity expert out there, a Harvard geneticist, and it's just a little muddy because he has this pill, and then he comes up with a study, and then the study's not necessarily matching. They're not able to duplicate it. You know what I mean? So you start to wonder, is some of the people who are in this space giving messages that are more about them trying to be maybe make a profit. But I just want to hear from you, like, with so much noise out there, do you feel that the longevity space is a space where you've seen some great strides, some hopes, and maybe even as you talk about that, talk a little bit about, because I'm all about health span, but I'm not sure all my listeners know what health span is. So talk a little bit about health span and how you see the whole longevity space.
Yeah, sure. So, great point. Health span is the number of healthy years we have without major illness, and lifespan is the number of years we have altogether. So, it's sort of implied that if we want to increase our longevity, we don't want to just increase our lifespan and have an extra 10 years in a nursing home,
Right.
So the idea is we want to increase health span with lifespan. So when we say longevity, that's what we mean. Thing that blew me away about longevity, the older I get, the more interested I get in it out of self-interest.
Yes,
So,
of course.
But the interesting thing that blew me away is learning about the common root causes, the metabolic effects of lifestyle and all, is a very interesting thing, that there's a common metabolic mechanism that lifestyle affects, the diet and stress, all these things. They're basic signaling molecules like mTOR or AMP kinase. And the fascinating thing is that these are now being touted as longevity effects, and there's some pills that turn them down, that will turn down mTOR, but I think no one should take the mTOR medicine without doing lifestyle first. And if you think the rapamycin is going to save your life, you're mistaken. You need to change your lifestyle and then add on rapamycin. I take rapamycin, but the fascinating thing was these drugs that have the positive metabolic effects, like the diet and all, but you can now do it in a study. When they looked at the appearances of aging, things like gray hair, wrinkles in the animal model, when they turn their mTOR down to a metabolic enhanced state, like lifestyle does, the hair grew back and the gray hair changed to dark hair in the animal model. In the human model, when they put the cream on the skin to do the metabolic effects on the skin, the wrinkles decreased and collagen increased according to skin biopsies. This is a prospective trial, very small numbers, but and this goes on and on with things like age-related hearing loss. The hearing got better. Menopause, which is an age-related disease that women get, ovarian failure. In the animal model, turning the metabolism into favorable state actually slows down menopause, and there's studies doing that. But then the question is, well, that's great. Nobody dies of menopause or gray hair. What about these diseases, these chronic diseases that we talked about earlier, that all of us are going to die of statistically?
That's right.
Can the metabolic effects, if we use a drug to test that on, like mTOR, what's the effect? And long story short, the drug, when applied to the stents of the coronary arteries, the opening that open the vessels when you get a heart attack, they normally clog back over because we're not doing anything in the underlying disease. But when they're coated with a rapamycin, they actually keep the stents from reclotting.
Nice.
With cancer, the drug that has the positive metabolic effects actually is FDA approved for about 8 cancers, metastatic renal cell carcinoma and many others as a treatment for them. Alzheimer's disease. There are no effective pharmaceutical interventions that have any significant effect. It's the ultimate failure of the healthcare industry.
Amen.
Unlimited research and decades, unlimited funds, decades. But when they block mTOR and move them into a favorable position, or even going into a state called ketosis, which is a very favorable metabolic state, this will, in the animal model, decrease brain fog, mental function, but even in human patients can reverse some of the signs of Alzheimer's disease. Not in all patients, but some of them. So even there's indications that living this way, this metabolically healthful way with these lifestyle choices, will actually prolong our lives. And the last one I'll just mention there, it's not something that most of us die of, but it's something that we all have to be concerned of, and that's psychiatric conditions, mental health. And Chris Palmer and Georgia Eade and others have now shown that turning to a metabolic state, specifically a favorable metabolic state, by going into ketosis will reverse some, but not all psychiatric conditions, even to the point where they can go off their medicines and leave the hospital.
That's
So
right.
it makes me wonder, of course, is for all of us who maybe don't have a psychiatric condition diagnosed, but we all struggle with our ups and downs of our daily lives as we deal with our children, our spouses, our loved ones, our family, our friends, our coworkers. We all have ups and downs, and I can't help but wondering what the junk food was doing to me and everyone else that would be improved by going on a metabolically healthy lifestyle.
I live in and I wouldn't even call it a bubble, but as I think about my teams, everybody in my clinical environment, they kind of know what I do. They know what I'm known for, and most of them are hiding their plates as they walk by me. But 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 we celebrate a lot. We have a lot of team members in the building I work in, probably 120 to 130, and how much more productive would they be if they didn't graze all day on those delicious, honey buns and things of that nature. Um, but I don't know that many of them have felt what it feels like to not graze and not be hungry, what it feels like to have mental clarity. So I don't have dementia. My wife may have other opinions, but I know that since I've been eating this way, going from low carb keto and now carnivore, the mental clarity, even as I'm talking to you right now, and I did have lunch. This is being recorded in Chicago time, right around 5 p.m. now. My mental clarity. I did have some baked, chicken for lunch, but I just feel clear. I just feel like that movie Limitless, where you took a pill and things just got clear. And I just remember, when I wasn't eating this way, and to be frank, even when I was plant based, it was just at the end of the day, I didn't have anything in the tank. It was just gone. I was always thinking about food. So I think even for people who don't have concerns for cognitive decline, um, I think that the benefits that you will gain will put you in a better place than you were before that. So rather you're learning from Dr. Georgia Ede or Chris Palmer, the benefit will be there's a rare person. And I think about keto for refractory mental illness, that study, and how 100% of the participants showed improvement. It's hard to find a drug that'll do that. And you can do this without the side effects. So now we're probably both fans of intermittent fasting. I can't have you in front of me without bringing up the recent observational, whatever it was, abstract, that I just want to hear from you, from all my fans and followers. Let's hear from the Dr. Lufkin. What's your thoughts on this intermittent fasting concern, this abstract that suggested the risk for heart disease was going to be a 91% higher?
Yeah, it's very scary, and we have to pay attention to headlines when they come
That's
out.
right.
And the first thing I do when I see a headline or a claim is I look for the paper. And in this case, there's some problems. First of all, it wasn't a publication, so it hasn't been peer reviewed.
Yeah.
It hasn't been submitted for study. So it was an abstract. If I'm correct, it was presented at a meeting. So
Yeah.
there's less peer scrutiny. There's a little bit of peer process for the abstract, but the data isn't subjected to peer review. And even more problematic is that it was a observational study rather than a controlled study. If I believe that, if I think that was true. But we'll have to look when the study comes out to deal down on it. I would like to say, though, that I think it's inappropriate for the journals to quote abstracts like that,
Right.
especially clickbait headlines like that got my attention, got all of our attention, because they're misleading, and those headlines now appear in newspapers, and I'm sure we're both bombarded with questions about that. And I think that sort of behavior, quoting articles that haven't been published and that haven't had peer review, is disingenuous, but it's also harmful for people, because
Mm-hmm.
some people I know have actually said, well, I'm not going to do intermittent fasting anymore. I don't want to get a heart attack. And that's really not the message we should take from that. And so I think a lot of people were misled by that,
That's
and
right.
it doesn't really, until there's a paper out, then, I'm not changing my behavior, and I'm
That's
not
right.
concerned about it.
I do appreciate the fact that you're saying until there's a paper out. And what I think is important is whenever we hear a headline, we know how to look at it properly. But more importantly, I'm not in a cult of beliefs that I have to keep the same. We were both plant-based. We changed. Like you said, if you show me a study that shows Coke is good for me, I'll be happy to do that. I'll be happy to drink that Coke. Because Coke, when it's cold, can be very delicious. So I do appreciate, for everybody, as we get new information, we learn better how to vet it. If you don't know how to vet it, listen to conversations like this, listen to people you respect, hear what they have to say. Don't trust anybody, trust but verify. And I think that's a better approach. But we're going to continue to evolve. The longevity space is, in my opinion, fairly new. The metabolic space is fairly new. So we're still learning. Certainly, you could argue carnivore is very novel at this point in terms of research. So we got a lot of work to do, guys. But I do want to transition to your book, Lies I Taught in Medical School. There is confession time. It's time for you to confess and share some of the lies that you've been teaching these bright minds. They've worked hard, they stayed up late, and they got in front of you and expected better. So I appreciate you having literally a written text of confessions. And now we want to share a few. And I'm going to start with the one we touched on already, which is dementia. My father-in-law has dementia. I'll be seeing him later, not today, but tomorrow. I hate to see what dementia does to people, but we make the best of it. So in terms of the things people can expect from your book, what lie did you teach about dementia?
Yeah, and the title of the book is intentionally provocative. Who's
Mm.
teaching lies in medical school? What? That's
I
that
know.
never happens. But actually, I was inspired by our friend Ken Berry's book and other people who've written books with similar titles. But ultimately, I was inspired by one of the greatest physicians of all time, named Sir William Osler. And he has a famous quote about medical education, which he actually delivered it in a speech to graduating medical students on the day they ended medical school and got their degree. And he said, and this was 120 years ago, but he said, "Gentlemen," and at the time, most MDs were gentlemen, or at least male, if not
Right.
gentlemen. But he said, "Gentlemen, I have a confession to make. 50% of what we've just taught you is a lie or is
Wow.
incorrect." He said, "And furthermore, we're not sure which 50% or which half." But it speaks to the challenge that we all face in science, but in medicine in particular, that it's an evolving field. And
Hmm.
whatever we're learning today, half of it may be wrong in 5 or 10
Hmm.
years. And unless, we're all busy as physicians, as healthcare professionals, everyone's busy in our lives. And unless we keep up with these changes, we're not going to be able to come up with the best information, and we will be teaching lies. And I
That's right.
believe there are some lies out there each chapter has a lie to it. And the dementia chapter, I think the lie was that there are a few things with Alzheimer's disease, the main dementia type of disease, that Alzheimer's disease is based on beta amyloid accumulation in the
Right.
brain. That's sort of the working model. And
That's right.
we look at instead a metabolic model based on Dale Bredesen's work and others who look at a multifactorial, especially metabolic practice.
That's
And
right.
I sort of underline the effect of ketones, either exogenous ketones or a metabolically healthy diet, like we've been talking about, that will put a patient into ketosis. And a good friend of ours, Heather Sanderson, who works with, was a protege of Dale's. She has a clinic for Alzheimer's patients where, unlike most Alzheimer's clinics, they go home at the end. It's not a clinic; it's a nursing home rather, and
Right.
they're discharged. And I was talking to her about her secrets, and she said, "Well, one thing we do is we put every single patient on a metabolically healthy diet.
Yeah.
They're in ketosis." And I go, "Oh, that's great, but how do you know ketosis works?" And she said that, yeah, for some patients, it's dramatic. Mr. Jones, when he's in ketosis, he recognizes his grandkids and
Hmm.
smiles and hugs them. When he goes out of ketosis, he can't remember their names or who they are.
Wow. That's amazing. I think I'll need to look that up for my wife. We just had a lottery like fun moment within the last few weeks, and it was like, so dear, if we win the lottery, what would you do? And she basically said, and she kind of aligned with me because what I would do is open up metabolic clinics everywhere. She said because of her dad, I would open up metabolic nursing homes everywhere. So, and I know that there may be a point of no return, but the opposite is true in nursing homes in terms of how people are fed. I mean, they're eating dessert almost with every meal. A whole lot of sugar and starch. Starch is cheaper, and the sugar is something that they'll eat, and it's just the idea that someone could literally remember what they didn't remember simply by changing their diet is profound, and it's hard to find a drug. And you're right in terms of where we failed. Dementia is clearly an area of science that we failed at, and
Yeah,
yeah,
my mom died of Alzheimer's disease. She passed just a few years ago, and
wow,
we sought out the best care at the time, which was to basically put her in a room and feed her sugar and starch until she
yeah,
eventually died.
yeah, yeah,
I didn't know what I know now. The way I
right.
understand this, I would have done it very differently. But my understanding of it is the exception. And most patients, like you say, in nursing homes with Alzheimer's and mental problems, are fed the worst kind of diet for metabolic health that, in my
That's right.
opinion, will make the brain fog, the dementia worse.
That's right. That's right. And again, there's hope. Even Amy Berger's book, just trying to provide hope for people. So we should probably have a link to Amy Berger's book and Chris Palmer's work, and of course, Dr. Georgia Ede and her new book, just to give people tools to help them when it comes to that. I interviewed a gentleman by the name of Dr. Paul Mercer. So if anyone wants to check that interview out, Dr. Tony Hampton, Dr. Paul Mercer, or just Dr. Tony Hampton Cancer, and he did a kind of a class for cancer. And of course, he shared perspectives that were not mainstream about how to deal with cancer. So another thing that is challenging, just like dementia, is cancer. So, how dare you, doctor, lie to your medical students about cancer? So, so what things, what kind of talking points that you touch on related to cancer and how you look at that differently now?
Yeah, I hate to sound repetitive here, but
Yeah,
the fascinating thing is that changing patients to a metabolically healthy diet, specifically a ketogenic diet, is now being applied for things like glioblastoma, malignant brain tumors, and other types of tumors. Other types of cancers, not as a substitute for their mainline treatment, but as something that will make them healthier. So in the book on cancer, I relooked at the question that cancer is a disease, a genetic disease that's caused by mutations, cumulative mutations over time, when actually I believe it's a metabolic disease, and that it responds to metabolic factors. And there's a number of arguments for that, like the Human Genome Cancer Project, where the cancer mutations were mapped, and they're very inconsistent.
Yeah.
And instead, I think there's a different mechanism for cancer, but it's driven, like Otto Warburg, the Nobel laureate.
That's right.
It's driven by glucose metabolism and factors there. And that's why, again, this metabolically healthy lifestyle can, in some cancers, and probably many or most of them, improve the outcome. And it begs the question, maybe being on this metabolically healthy lifestyle may even slow down or delay the advent of these diseases, whether it's Alzheimer's disease or diabetes or obesity or cancer or cardiovascular disease. Because as we all know, type 2 diabetes doesn't start when I'm in my doctor's office and she looks at me and says, "You're a diabetic."
That's right.
Instead, it's years to decades earlier. And cancer probably has its roots earlier, as well as does those other diseases. So if we wait until the doctor diagnoses them, we're at a disadvantage. So the idea is prevention with lifestyle. If we can't cure cancer, let's prevent it, like Alice Grace says with their new video. And also,
that's right.
That's the idea. Right. And it's empowering to all of us. We become healthy, we eat metabolically healthy, we live a healthy lifestyle, and then we delay the aging, we delay the onset of these diseases, and we increase our health span.
Yeah, I think all of that's wonderful, and it all makes sense. And when we did our little cancer conversation, me and Dr. Paul Mercer, again, Dr. Warburg and other concepts with it. But at the end of the day, it seems to be more consistent that cancer cells have dysfunctional mitochondria and metabolic issues as opposed to, mutation issues. So it's really, and again, it provides hope because now you can do something actionable to fix it. And the thing that has impacted our family, with my wife in particular, was type 1 diabetes. But diabetes is also an area which is clearly metabolic. So what about diabetes did you share in your book, which you felt was a lie in terms of how we educate about it?
Well, I think my entire thinking of diabetes, and when I say when I say diabetes, I'm referring to type 2 diabetes, just because today that's the vast majority of patients,
right.
And that has the clear link to dietary factors as being causal, right, not just for treatment.
Absolutely.
One other thing that changed in my thinking about diabetes is, as a doctor, I used to divide patients up, either you have diabetes or you don't, you have this disease or you don't. And it would and what I realized, a couple studies have come out showing adult, non-diabetic, adult Americans, if you look at their HA1C levels, which of course is the marker for diabetes, over time with aging, it gets higher and higher and higher. And when it crosses a certain point, that's the diagnostic criteria, of course, for type 2 diabetes. So it sort of a light went off. I realized that, well, maybe it's not an on and off switch, but diabetes is maybe like gray hair, that many or most of us will get it if we live long enough and don't die of something else first.
Right.
So what is that? How does that inform our lives now? Well, it means that the dietary choices that make me metabolically healthy may also slow down the risk for diabetes, because the same metabolic choices now are the same non-diabetic, or same choices that will reverse diabetes. So the lie was, that insulin is the best way to treat type 2 diabetes. And admittedly, some patients where their pancreas is gone, there's no choice. But
that's right.
It's been shown that, for earlier patients, that the insulin, while it will control the spikes in the sugar and may be life-saving in the short term, it doesn't control the long-term effects. So it's not like, well, I could either do a diet or I'll just take insulin. No.
Right.
If you take insulin, you know better than I do. It's going to continue, but it's a message I don't think that's getting out there. And by
Mhm.
switching to a carnivore diet, many, if not most, type 2 diabetics will have improvement in their diabetes, and some in reversal even.
That's right. And I do want to, since I brought up my wife, just a shout out to anybody who's listening who's a type 1. And like you said, there's treatment, there's root cause, and the root cause of type 1 may not be the same as type 2. But if you want to achieve a A1C that's near normal or normal, you can't do it with insulin alone. You have to reduce the burden of those glucose spikes by reducing the carbs, whether it's keto or carnivore. And if you do that, you now have the ability to take a person who may normally average an A1C of 7, 8 or more to a normal 5.6 or less. So I just think there's hope restored in both scenarios, and I just wanted to put that in front of people. I do want to the last lie I want to ask you about is the controversial one, which is the one related to medications like statins. And I'm just curious, did you talk about the statin question, since it's such a controversial issue?
Yeah, I did, and that was the one of the cardiovascular lies about statins. And statins are heavily used drugs. They're very powerful drugs, but their benefits have been exaggerated by using relative instead of absolute effects. So the effect, even in big studies, is about 1% of benefit,
Hmm.
which is great. If heart disease is the number one killer, I'll take 1% anyway.
Right.
But the problem is there's
Hmm.
side effects with statins,
Yeah.
and the same studies minimize the side effects. And uh, even cholesterol is such an important. Cholesterol is one of the things that statins lowers, and cholesterol is so important that low cholesterol has been associated with other causes of death. So much so that in large studies, the all-cause mortality, in other words, the total number of people who die, doesn't change whether you're on statins or not. The statins people have fewer heart attacks, but they have more suicide, and they have more other things that may have something to do with cholesterol metabolism in the
That's
brain or
right.
something.
That's right.
But so I'm critical of statins in the book.
Yeah. I love
I think
that.
they do play a role in some patients, but I'm critical for them on patients that are low risk, who haven't had a heart attack, or if they
Right.
have a 0 calcium score. Even the American College of Cardiology says it's okay to get off statins, as you know.
That's
So
right. That's it. And I think, and that's the bigger message. So for everybody checking this out, we have to individualize recommendations. Like the doctor said, we're in conventional systems where statins are encouraged. So there may be patients who are really high risk. They've just had a heart attack or a stroke, and you may be able to justify statins individually in some people. But man, if you, I mean, literally a person with diabetes who has a 0 calcium score doesn't have to be on a statin. Unfortunately, that's not standard of care, but that's the recommendation. So, and who knows how long it'll take for large health systems to catch up with that recommendation, if ever. So, and not to mention the politics behind not recommending statins, who's funding who. So I want to kind of get close to wrap up by asking, because we have a lot in common. I know I've said that a few times, but one of the things I think we have in common is we try to meet people where they are. So when it comes to you're talking to a family member or a friend or a medical student, and they're like, listen, I'm going to be a vegan. I'm going to do Mediterranean. I'm going to do the DASH diet, and that's what it is. So what's your philosophy about the different dietary patterns out there? Although we lean towards animal-based keto carnivore, how do you deal with these other dietary patterns when people are asking questions about them?
Yeah, it's a great question. I mean, one of the things that I wasn't aware of before, a light that went off, was that for some patients, for some people, education's not enough. Like, I
Hmm.
have some friends who are, highly functioning, intelligent people, and they understand that sugar is bad for them and it will make their heart disease worse, and they have heart disease, yet they still, I see them next day and they're putting sugar in their coffee
Right.
and, and seed oils and different things. And I realized that it sometimes education just isn't enough, that
Yeah.
we're complex animals. I mean, I'm a recovering junk food junkie myself, so I can slip back in easily if they're around me. So it may involve more things like coaching programs, like
Mm-hmm.
community. You get together with people, and even we're looking at low dose naltrexone for junk food addiction, and
Mm-hmm.
it's
Wow.
fascinating. This drug is normally, as you know, used for other substance
Yeah,
abuse,
that's right.
but it's fascinating. It's one of the other drugs that now there's suggestive evidence that it may improve longevity. Low dose naltrexone as a
Nice.
longevity drug, off label, because
Mm-hmm.
some of our addictive behaviors will be minimized.
Right. That makes sense, and that's a very interesting concept, and I just think all-cause mortality and how you described it earlier as it relates to, statins versus not having statins. I don't think the average person, even the doctors, think about that because, at the end of the day, what's the goal? Well, the goal is have, a really great health span, but also, you just want to be able to know that if I end up being here longer and I have a good health span, then I've achieved my goal. Now, whether I've slightly mitigated this risk versus that risk, it doesn't matter. The ultimate goals are what they are. So I really hope that as people listen to this, they are getting a little bit more nuanced, and they're not just shout out to your doc, but
Yeah, thank
getting
you.
more nuanced about how they think about these issues. I remember when I interviewed, I think it was the ketogenic woman who has the cooking channel, and her dog kind of started the podcast with some, energy, and I thought that was wonderful. So that's what I love about recordings. Now, having said that, um, let's kind of wrap up with two things. One is I'm going to ask you about how you're going to plan to protect your nest. But before that, what about, okay, again, somebody's in front of you. You mentioned seed oils. And I know these are concepts people have heard, just high level, how to be healthy, how to achieve longevity. What basic recommendations would you give the average person you would speak to about that?
Yeah, the diet recommendations are first and foremost, and even if you don't change your diet and eat the same things, just don't eat all the time and
Yeah.
narrow your eating windows. Stop
Well, I can
snacking.
intermittently fast. Oh, thank God.
Yeah, even better. Yeah, skip breakfast, maybe skip
That's right.
lunch. I usually do one meal a day, and I've never
Yeah.
felt better. Like you say, I do it because I feel great. But in the food choices, I avoid carbohydrates and starches, the things that drive up the glucose. I
That's
avoid
right.
seed oils because it's the pro-inflammatory factors with those. And then personally, I also avoid grains. Not that I
Yeah.
have celiac disease or gluten sensitivity, but many experts believe that up to half of the adult population have immunological effects due to proteins from gluten or proteins from grains, not necessarily gluten, that
Mm-hmm.
drive inflammation. And plus,
Yeah.
if you live in the U.S., our grains are bathed in
Oh,
glyphosate, which is a weed
that's
killer.
right.
So,
That's right.
so
Yes.
those three things for diet, and then exercise, both mental and physical exercise, sleep, both quality and quantity, and
That's
then
right.
stress, like I talked about before.
Absolutely. All of that sounds like music to my ears. And yes, when I eat grains and things like that, my stomach doesn't like it. So I appreciate all of that. So again, you're sharing. We have to keep you around so you can talk about your book for years to come. Maybe write some more books. So we want to make sure you protect your nest. So I know you think about your health often because you're into longevity, but anything over the next 12 months, you're really going to give a little extra attention so you can be here longer.
Yeah, I mean, well, I'm paying attention to the breakthroughs in the longevity space because they're just in the last 5 years, things are happening like every week or so. There's the field is moving very fast, but the longevity translates into all these chronic diseases, the things that make us live longer by affecting the chronic diseases. So I'm super, super, super excited about that. But yeah, it's just I want to focus on my kids before they leave and go to college, and I've got a few more years when they're at home. But
Yeah.
I see my life transitioning, and
Yeah.
want to balance all that life family balance.
I'll never forget the day myself, my wife, my youngest son, who was still in high school, and my oldest son, who was entering his first day at WashU in St. Louis, and we gathered outside one of the cafeterias, and it was kind of that moment when we were getting ready to leave. And just thinking about it almost makes me feel emotional. My son started to shed a tear, and by the time we look around, including we were all crying like newborn babies, man. So it's just something about you having this newborn that you bring home from the hospital one day, and they just become they're supposed to be in your house. That's just what happens. And so the idea that they wouldn't be coming back home and we were proud and excited, but and then you get back home and you're like, oh my God. So you definitely have some interesting transitions to come your way very soon. But it's wonderful. Now it's like now we're like looking for jobs. And so it's really going to be wonderful. And that's kind of what you're doing all of this for. You raise them so they can be independent adults. But I do appreciate you. I think we are kindred spirits. I love what you're doing. I'm happy you carve out time to not only write the book, but to educate the next generation. And of course, to spend time on a podcast. I know it's busy and you still find time to spread this message of healing. So thank you so much, Doc, for sharing your message of healing on the Protecting Your Nest podcast.
Oh, thank you so much, Tony. We are kindred spirits. I feel a connection with you as well, and I look forward to deepening our relationship over the years. And thank you for all the great work you're doing with the patients. You're doing the real work there.
Absolutely. Thank you so much. And I'll wrap up and share with my audience, Dr. Robert really gave us a great insight into, just thinking about how we're training our doctors and what lies we may have, not on purpose taught them over the years. And hopefully as we are learning more and evolving, we'll be able to do a better job. I really thank him for that. And just having the courage to, write a compelling book. And I really encourage you guys to share that book with friends and family, because I think that it's going to really open your eyes. And I think your eyes being open will then allow you to then start to question things, because you may have not questioned some of the concepts in the book. So, and these lies are not just, harming those, intellectually smart doctors out there, but they're harming their patients because they're not being exposed to what could potentially heal them. So if you have a doctor who is so afraid of keto or carnivore that they never walk with their patients who is interested in that diet, that creates harm. So I really hope that the medical establishment learns how to better train its doctors. And until that happens, advocate for yourself. You will do that by hearing conversations like this, and of course, sharing these conversations with your friends and family. So again, I thank you and appreciate you for coming to this episode of the Protecting Your Nest podcast. And until the next episode, continue to be safe, be well, and continue to protect your nest.